Snooki and JWoww from the Jersey Shore both had baby girls a few months ago and were constantly complaining how much pain their backs were in. What can you do safely about back pain during pregnancy? Let's ask Dr. Rascala of Performance Spine and Sports Medicine.
Low back pain is very common in pregnancy and tends to worsen as you get later in the pregnancy. As the uterus is growing with new life, it shifts your center of gravity forward and weakens your abdominal muscles, putting a strain on your low back. Additionally, there are hormones secreted during pregnancy that make your ligaments in the pelvis looser in order to prepare it for delivery. This can make your pelvis feel unstable and cause pain with sitting, walking, or rolling over in bed. This is known as sacroiliac joint dysfunction. You may have pain deep in the buttocks and into the back of the thigh. Pain can also move into the groin area as the ligaments get more stretched. However, pain typically does not move past the knee or into the foot. If that is occurring and there is associated numbness or tingling, that may suggest more of a pain coming from the discs in the low back and should be evaluated by your physician. This is rare compared to the aforementioned pelvic pain and is typically present even before pregnancy. True sciatica, which can be caused by a herniated or bulging disc in the lower part of the spine, affects only about 1% of pregnant women. Any loss of sensation or weakness in one or both legs, or a loss of sensation in your groin, bladder, or anus, which may cause incontinence, are signs that need to be evaluated right away. At Performance Spine and Sports Medicine, we have expert physicians that specialize in differentiating the types of low back pain in pregnancy. We have physical therapists that specialize in pelvic floor therapy and understand how to work safely with pregnant patients. We offer safe, minimally invasive procedures that can be done with ultrasound guidance, which is safer for the baby. It is important that when you have back pain, you don't take to curling up in your bed. Bed rest does not typically make pain better. In fact, exercise, including strengthening and stretching of the low back, may help. You may try aerobic low-impact activities such as walking or swimming. Just be aware of proper biomechanics as well as your posture. For lumbar pain, try doing pelvic tilts, which can ease back pain by stretching your muscles. Here's how. Get on your hands and knees, arms shoulder-width apart, and knees hip-width apart. Keep your arms straight, but don't lock the elbows. Tuck your buttocks under and round your back as you breathe in. Relax your back into a neutral position as you breathe out. Repeat at your own pace. Also, don't forget about proper nutrition and getting a good night's sleep. Back pain affects about 75% of pregnant women, but the good news is it should not affect the health of your baby. Although you may feel low back pain is necessary in your pregnancy, there are safe and effective treatments that make it more tolerable.